Okay, alright. So ayan, welcome back dears. Alright, so for the part 2 na, welcome now to the part 2 of our blood culture lecture, okay? Alright, and for this part, we're going to talk na about how do we collect specimen, okay? Or how do we collect our blood specimen. But before we start there, guys, I forgot to emphasize, you may be thinking na, sir, ganong important na maano na to ang blood culture? Or ganong important na, or ganong significant ang blood culture? Because recall, guys, that blood is a very sterile, okay? It should be, under normal circumstances, is a sterile body site, okay? In a way, or body tissue, tsakto naman, blood is a tissue. But, so that's why it's really significant we talk about blood culture because the presence of any kagaw there, no, except lang in cases na contamination, usually they signify an important or a significant they signify a very important or significant na condition of the patient. All right, so that's why we are talking about blood culture because again, under normal circumstances, it's a sterile site. So kanang yung mga sterile site, blood, all your internal organs usually are sterile. So kanang blood ninyo, your fluids, mga pleural fluid, peritoneal, CSF, all those are considered sterile. So the presence of any pathogen there, okay? Again, except lang in cases na contamination sa pag-collect, usually signify or play an important role. And the presence of bacteria in those sterile sites usually lead to infection. That is why we're talking about this, okay? So ako rang gi-emphasize, okay? Kapag niya mag-wonder mo, ganong na blood culture, no? Or ganong na mga nani. Or anyway, so now we're going to talk about specimen collection, okay? So how do we collect the specimen for blood culture. So of course, our major specimen is blood. All right, so we now follow again antisepsis. Our goal now is to really limit, okay, and avoid as much as possible external contamination sa ato ang specimen. Knowing na, again, blood is a very, very kanang precious ba? Or kanang very ano kayo ato ang critical there. Very critical kay ato ang specimen, which is blood, no? So, again, with all the other specimens naman na itong na-discuss sa bakte, it's our ultimate goal na sa collection palang daan, they are free of contaminants, right? Okay, so here, samot na sa blood, blood is not an exemption. If in fact, mas kailangan pag-use sa blood na kanang na-adjust antisepsis or i-limit ang contamination, alright? And that's why we practice antisepsis. So again, usually your blood nowadays are inoculated to a blood culture medium, all right? And this is an enrichment medium. So therefore, hence, we need to limit or we need to avoid normal skin flora contaminants. Because again, enrichment medium man siya. So, pwede niya mapadaghan to mga contaminants, okay? Which we don't want. Okay? Again, those are contaminants. And these are the ones that do not cause the disease, all right? What we are really looking after is the pathogen, all right? Okay, so, muna siya ang rational nga nung kailangan tag mag-antisepsis. Still the same, we don't want any contamination, especially from the skin flora. Alright. Because again, ang point ra sa pag-collect sa imuhang blood is venipuncture. So, it's still the same, di ba? For venipuncture, we disinfect using alcohol and all that. But this time, for blood culture, what we use now is iodine. Okay, so iodine, pwede povidone iodine, alright, betadine, or mga iodine-based na naay alcohol ba, okay? Or pwede pong chlorhexidine, ayan, chlorhexidine, okay? If naay alcohol sensitivity. Because again, iodine now, in a way, mas makapatay na gyud siya og kagaw or imuhang normal skin flora, okay? Now, what we do for disinfection sa imuhang arm, okay, since this is still venipuncture, what we do is, unahon na mo ang alcohol muna, alcohol, tapos iodine naman, and then alcohol. Okay, yan na siya. Alcohol, iodine, alcohol, or pwede pong alcohol na iubad na kutubraani, alcohol and iodine. And then, you let the iodine stay there for about mga, if I'm not mistaken, nalimot ko mga 1 to 2 minutes ba? Alright? Para na ay disinfection. Okay? Or para jud malimit and as much as possible ma-avoid ang normal skin flora contaminants. Okay? Alright. Pero if na kay chlorhexidine, usually, if kato ako na experience sa internship, if na kay chlorhexidine, pwede nang walay iodine. Like, ano na mo gana siya? Kanang makabatay mo ng mga alcohol na gipack na gani, na siya sa mga kaning square na mga inana, niya alcohol siya. Yes, na yung mga inana na chlorhexidine. So usually sa lab na ako, sa Soto na ako na experience, chlorhexidine na packets mga inani. So mura na siyang gisiun, then nanay ka ng murag cotton or tissue na basa na chlorhexidine, then muna na siya ang i-scrub sa imuhang arm. Okay? And again, still the same concentric fashion. So imuhang arm dapat concentric. Okay? Alright? Tapos, again, hulaton mo siya na mo dry. And again, dapat dili siya i-wipe na, no? Tapos, insert na ka sa needle and you collect the blood. Alright? Okay, and as, another thing here is, ang withdrawn blood or ang gikuha na blood kay directly put into culture bottles or imuhang tubes with anticoagulants. Now, why do you think so? Why do you think, blood should be put directly in a tube or bottle na naay media, blood culture bottles, or if wala blood culture bottles kay, unsa na tube gani for blood culture, di ba yellow, di ba for microbiology, so yellow. What if, why do you think so? Naibutang siya dapat o anticoagulated tube? Because, di ba, lain online wala makatubag. Because again, your clots, di ba, your blood will clot, okay? And what happens is if muklat ang blood, that could trap the bacteria na present sa imong blood. So what happens, if nanay clot na mahitabo, and timing pag yun na trap ang bacteria dito, so therefore wala na tayo ma-isolate. Okay? So, dili na ito makita ng pathogen, di na ito ma-identify kung unsay cause sa disease or sa sepsis sa imong patient, di ba? So, as much as possible, mabutang dayon imong blood into the blood culture bottle, okay? Katong yung later akong i-show and atong i-discuss. And if not, katong imuhang test tube, blood collection tube na yellow top, di ba? For blood culture. But most of the time, ako ang na-experience, wala na blood katong yellow top tube na ginagamit for culture. It's more on directly na gyud siya sa blood culture bottles. Okay, so I'll show the picture here. Ayan, sa next. Okay? Again, after venipuncture, disinfectant is removed with an alcohol pad. So, for aftercare. Alright. Okay, so here's an example. Ayan, those are example of blood culture bottles. We'll discuss that later sa different systems or methods on blood culture. Okay? So, those are blood culture bottles. And inside them, they have already the broth. Okay? Kanang broth na brown dira. That's already an enrichment broth for the blood. So, what you do is, kaning test tube bottles, after nimo og syringe, no, venipuncture, imong i-inject ang syringe dito and then imong i-dispense ang blood. Okay, so we'll see in this procedure. Again, your blood culture bottles, imo siyang tantangon og cap, of course, kung saan mo pagsulod. Then, of course, disinfect the rubber septa or kaning sa taas. Of course, we want to disinfect. Again, limit the contamination. So, kaning siya, guys, kaning murag gray sa tunga, that's rubber. So, mapansak na siya. Mura siya kanang rubber na taklob sa inyuhang vials, gani, katong gigamit nato for water back test sa public health, katoy, nato siya na pagka-rubber. Okay, so mapansakan na siya syringe. Alright. Okay, so after that, disinfection, you again disinfect with the site kung asa ka mo collect. And then you collect blood. Ayan. So as you can see, diretso na siya sa imuhang blood culture bottle, di ba? Usually, muna ito ang weigh. Okay? So, kanig pa ETS, butterfly, mo nila ang style. Pero if syringe ka, kato ng 3cc, so after mo venipuncture, so, diretso ni mo, like kani syringe, mo na siya ipansak diri. Okay? Tapos, diretso na po nang mugawas ang blood padulong sa imong culture bottle. Okay? Alright. Tapos, ayan, as you can see, yan, blood diretso na sa culture bottle. Alright? And of course, or kani, that's what I've told you, ang syringe, imo siyang ipansak sa imong blood culture bottle. Alright? And then dispense the blood there. Depending sa blood culture bottle na manufacturer or brand. Okay, so we'll go to that later. Alright? Okay. Ayan, so that's for specimen collection. Again, ang point lang yun is follow asepsis, antisepsis. Okay? Para dili maka-introduce o external contaminants. Because we don't want that. Okay? Alright. Ayan, now we go na to specimen volume. So, as mentioned here, it's important po now we know the volume kung pila to i-collect. And there's a direct relationship daw with the volume of blood collected and the rate of positive results. Meaning, if daghan-daghan imo volume na makuha, of course, mas taas mo ang chance na ma-detect nimo tong kagaw. Kay medyo taas man ang volume imo nakuha sa blood. Right? Samot na if gamay pa ang concentration sa kagaw sa imong blood, so mas okay yun na daghan ka ma-collect because again, mas higher or mas taas imong chance na ma-detect jud tong kagaw. Alright? Okay. So as a general rule, 4% of a patient's total blood volume can be taken safely for culture. So kana in your internship, you'll experience na tanay mga na mga patients or mga watcher kana mga kuyog na tagbantay na moingon na, uy, sige na lang makagkuhag dugo sa akong pasyente or sige na makagkuhag dugo na ako, di ba ko mahutdan og dugo? That's a common na gyud kay na siya guys na murag reklamo nila. So, of course, as a medtech, yes, Pakpak 4.0 sa HEMA 1 and HEMA 2. Yes. Of course, explain na po ng ma'am, dili ka mahurot og dugo, no? Gamay ra niya mong gikuha. Normal ra ni dili ra ka mahutdan. Okay, so yeah, one of the ways na murag ka nang magpakalma og patient or paano ra good pakalma sa imong self para dili ka mabuisit. That's normal. So always, it's your job as a medtech pohon or as a medtech student, a medtech intern to be calm, no? To be caring pa rin kay imo man ang patient. Okay? So wag magpainit ng ulo. Although wala ko naka-experience anang murag maglagod yung patient. I've experienced that a lot of times. Kana yung mga patients sa murag kinsay medtech diri yung inana. So magbut-but man ka inana ba. So ana lang. Pero kato na mga patients ginagmay ra to. Kato na mga patients kailangan po to silang put them to where they belong, something like that, no? Mga entitled ba kana mga entitled. But anyway, lahi na chika, but muna siya ang point. So 4% of the total blood volume of the patient can be safely taken for culture. Again, dili na mahurot ha inang patient, dili na mahurot imong dugo ana. All right? And our ratio nato is 1:5. So ang volume sa blood is 1:5. So mas daghan jud ang broth kaysa sa blood. Okay? 1:5 to 1:10. Okay. All right. So for age, if less than 10 years, 1 ml of blood for each year of life. So example, if 9 years old, kay 9 ml. Kung greater than equal to 10 years old, 20 ml. And kung greater than equal to 10 years old pero poor veins, pwede rag less than 20 ml. Now, in your sa practice, no, ako na experience, mo depende sa imong blood culture bottle na gamiton because each blood culture bottle na imong gamiton mo specify na siya kung how much blood kailangan. So nayuban na kailangan rag 1 ml, nayuban na kailangan 5 ml, nayuban kailangan 4 ml mga inana. So or nayuban jud na 10 ml gyud na hutdon gyud nimo. Pero kalas magud kay siya kay usually if na blood culture na results or requests sa imong lab, usually what they request is duha ka blood culture bottles from different sites. Okay, so example, ang usa kay diri, ang usa kay dapat sa kamot, mga inana ba. So para murag again more chances of winning, more chances of isolating the pathogen, parang ganun. So lisod jud kayo if 10 ml niya diri na veins, it's very lisod. Kay gagmay kay yung veins diri pwede mo collapse dayon. Yes. Ato mga palusot, bisag wala dito na hit ni collapse. Yung mga explain na ng patient na, ma'am, ni collapse mo yung vein, sorry kayo. Common na practice, been there, done that. Joke lang. Don't follow ha. Anyway, depende. Anyway, alright. So muna siya ang mga, theoretically, this is the amount of blood na itong kailangan. Kung less than 10 years, 1 ml per year of life. So example, if 9 years old siya, 9 ml. Kung 7 years old, 7 ml, inana. If greater than 10, 20 ml. If greater than 10 pero poor ang veins, you collect less than 20. But again, depende na siya sa blood culture bottle, sa procedures po sa lab mismo. Okay? Alright. Ayan. Now, for the specimen volume, again, so just weight volume protocol. If, of course, magkadako ang patient, magka-increase yung weight, so magka-increase po ang volume na itong kuwaon. Okay? So, in a way, direct na po ng relationship. Kaya of course naman, if niwang kayo ang patient, di po na ganyan mo kuwaan dyan taas na volume, no, maluwi ka, basta niya mas maluya na siya or what. So, correspond lang, na corresponding volume, depending on the weight of the patient. Alright. And for frequency, like how often do we collect blood? Alright. It would depend on the type of bacteremia in terms of katong duration niya, okay? In terms of the duration of the bacteremia. All right? And it's important po to determine kung unsa na type of bacteremia, if it's transient, is it continuous ba? Para makabalo ka kung kanusa ka mo collect og blood. Because it's important po to know when to collect blood, okay? And the frequency of collecting it. Because para mas make sure yun, para mas ma-ensure na makakuha jud kag pathogen na nag-cause sa disease, okay? So example, for transient bacteremia, so when we say transient, pwede na siya, dili gyud siya always present there, or pwede rag naa, pwede pug wala, mga inana ba, na murag, mo effort siya, pero day dili, naa siya sige, pero di ay, after a while, mawala na po mga inana ba, na mo yung mga kaila, na ako'y kaila, joke na. Okay, alright. So, transient bacteremia, not always there, yes naman, or dili gyud always na present there, okay? So, wala ray timing na pwedeng, wala ray recommended timing because again, na chances yun na dili ra ma-detect ang bacteremia or dili makuha ang pathogen kay transient raman. Okay, so mura siya in a way, ako pagsabot niya, mura na siya, try your luck, okay? Or like, ano na siya ba, kanang trial and error. But anyway, because that's transient, okay? So, no recommended timing lang. But for intermittent, when you say intermittent, di ba, from time to time, naaaang kagaw, alright? From time to time. So, murag, periodically ba, like, kung gabi in ani, sa gabi ira mo increase ang kagaw, pagkaugma, wala, inana ba? So, na period. Alright. So, if inana, then you collect blood before the spike of the fever. Alright. So, example, if ang patient ma-experience na og sugod na pasaka or galain na yung paminaw start, dili pa jud kayo taas iyang temperature, then that is the possible best time to collect the blood sample, okay, for culture inani, because it is during those time na medyo taas ang concentration sa kagaw sa blood sa patient. Okay? So kung intermittent, before an anticipated temperature rise. Okay? All right. Ayan. And of course, kung continuous, by the name itself, palagi nang ang kagaw kay gapuyo na gyud sa blood stream sa imong patient, naa na gyud siya sige there, by the name itself continuous, then of course, you can collect anytime. All right. Yes. No specific timing. Anytime ra kay continuous man. Ang kagaw mismo nagpuyo na sa iyang blood, ganahan na siya didto. So anytime ma-collect ra nimo and anytime ma-detect ra pod ang kagaw. All right? Okay. Ayan. Again, recommended that pila ka ml 60 within a 24-hour set. Kay, nga naman, mag 3 sets man ta kada collect. And di ba, each bottle kay 10 ml. So therefore, 3 sets man, and each set contains 2 bottles. So 20 ml per set, so munang 60 ml. Alright, so 3 sets of 2 bottles. Ganun daw ka bottles? 1 for anaerobic, okay, and 1 for aerobic. So what if ang kagaw na nag-cause yung bacteremia is an anaerobic bacteria? That could be possible because your blood can be a source of anaerobic bacteria. Or what if aerobic bacteria po? So mas okay na nang naatay option for the 2. Alright, so muna na ay 2 bottles for each set. And within 24 hours, dapat natay 3 sets. So therefore, na ay 6 ka bottles all in all. Okay? 6 ka bottles all in all. And each bottle contains 10 ml man. Or 10 ml man dapat imo i-collect. So therefore, mo nang 60 ml atong i-collect. Alright? Okay, dapat, kung continuous bacteremia, ang yang interval sa pag-collect is 30 to 60 minutes. So, ano jud ka nang, from time to time, or like intense good, or like short lang intervals. Because again, continuous man, sigirag naa ang kagaw. Alright. Okay, so at least 60 ml. So, blood culture 1 is still the same. First set for aerobic and anaerobic. Second set, 10 ml, 10 ml for aerobic and anaerobic until mabot ka sa third set. Okay, so muna mag-volleyball, no? Yes. So, third set. So, first set, second set, third set. Each set contains 2 bottles. 1 for aerobic, 1 for anaerobic. And each bottle, dapat 10 ml mong ihatag or ibutang na blood. So, muna siyang 60 ml atong kailangan. Alright. Okay. Now, again, it's not so much na palagi tang mag-collect kay dito na ito makita. It's much more on the fact that the greater the volume natong makuha, no? Bahalag kanus pa or like unsa atong interval, but at least the greater the volume, no? Again, the higher chances of winning, the higher chances of isolating the pathogen. Kay again, ubay-ubay man imong volume na nakuha. All right? Okay. Kay bahalag example transient, no? Not all the time naagyud ang bacteria. So at least man lang na if naka intervals na gi-follow niya in ani na volume yung makuha each collection, then in a way makayong ka na okay, so naa-jud chance na pwede jud makuha ang kagaw. Bahalag dili jud ka makaingon na sige siyang naa didto, inana ba? So at least by the volume, the amount nimong nakuha, you can say na again there could be a chance, okay, or higher chance of really isolating or collecting the pathogen from the blood. Okay? All right. Ayan. Okay, now we now go to your blood culture media. So unsa man ang mga culture media atong gamiton for blood culture? So again, this is an example of a blood culture bottle, all right? And the blood culture bottle contains a broth and an anticoagulant. Kano ganing kailangan ng anticoagulant? Because, again, clots trap bacteria, all right? And if ma-trap ng bacteria sa clots, wala na tayo ma-isolate, wala na pulos, all right? So again, ato anticoagulant, 0.025 to 0.050 SPS, sodium, polyanethyl sulfonate. Still the same anticoagulant sa mong yellow top tubes, di ba? Together with your EDTA, may nana, all right? SPS. Anong say function sa SPS? Anticoagulation, again, para mo prevent og clots because clots trap bacteria. Neutralization of bactericidal activity in the blood of the patient mismo. Like, of course, your blood has mga bactericidal, innate bactericidal na mga substances such as complements, mga lysozymes na siya. So, iyang i-inhibit all right, of human serum because again, we don't want that. Kaya again, mamatay atong kagaw na kailangan i-isolate. Prevention of phagocytosis because again, your blood has WBCs. So, para dili ma-activate ang imuhang neutrophils na mo phagocytize, alright? So, kailangan na SPS. Para again, still the same para ma-isolate ang kagaw. And lastly, inactivation of certain antimicrobial agents if the patient is undergoing antimicrobial therapy na. So, butangan nato siya para again, dili na mo affect to antibiotic sa kagaw. Because again, we want to isolate it. Alright. Okay. Ayan. But their SPS inhibits these bacteria. As you can see, medyo mga ano ni sila. Streptococcus is an anaerobic. Streptobacillus to Gardnerella, again, some fastidious na mga organisms. So if para dili sila ma-inhibit, we add 1.2% gelatin. Please take note. Kung saan mga organisms ang ma-inhibit sa SPS, kani sila. And unsay i-add para dili sila ma-inhibit by SPS, 1.2% gelatin. Okay. Alright. Ayan. Now, for some additives, pwede siyang butangan og osmotic stabilizers such as sucrose, mannitol, and sorbose for mga cell wall deficient bacteria such as mycoplasma, diba? So, some mycoplasma can lead to that. Mycoplasma species can lead to bacteremia. So, if muna siyang ang impending pathogen, then of course, we need this para ma-stabilize ang imong cell wall deficient bacteria na mycoplasma. Penicillinase, if the patient is undertaking penicillin para of course, ma-degrade tong antibiotic na penicillin para dili maka-affect sa growth sa kagaw. And ARD, antibiotic removal device, still the same, by the name itself, removes antibiotics. Again, if the patient had already undergone antibiotic therapy. And ARD may come in the form of resin or adsorbent polymeric beads. So, kani mga beads, kabante mo ana sa inyong blood culture na ay mga bottles, buhon sa internship na siya beads. Alright, so those are ARD. So, mutapot ang antibiotic there. Alright? Okay. Ang beads mukuha sa mga antibiotic. Activated charcoal. Alright? So, the same purpose. And again, for a back alert blood culture bottle, this is known as a fastidious antimicrobial neutralization. So, muna siya term niya sa pagkuha or ARD sa blood culture bottles made by Back Alert. So, that's a brand ka ng Back Alert. Okay. Alright. We'll talk about that later sa different systems of blood culture. Alright. Okay. Now, for incubation conditions, of course, normal incubation lang, 35 plus and minus 2 degrees Celsius. Alright? It could be up to 5 days kung automated, and usually most of the labs na akong na-experience po. And I think hospitals po na mga tertiary, automated ang blood culture, yeah. And kung manual systems, kay 7 days. Alright. Agitation, dapat na agitation para, again, mo increase ang oxygen for aerobic organisms if you want to isolate aerobic organisms. Rocking motion, followed by Bactec and Back Alert. Again, still brands of blood culture systems na automated. Rotary motion for Versatrek, still another brand. And kung anaerobic bottles, of course, anaerobic, tangtangon na tong oxygen, pa-increase na to ang nitrogen and carbon dioxide. Because again, we don't want oxygen. Kay anaerobic man sila. Alright. Okay. So, let's say next. Alright. Okay. So, for routine blood culture, just a little mga reminders. Again, we incubate the bottles at 35 plus and minus 2 degrees Celsius. After 6 to 18 hours of incubation, next na lang ni siya na video. Kaya medyo taas. Alright. Okay, so on our next video, we're going now to start on the routine blood culture proper na gyud, and then further show you the different automated systems and manual systems on blood culture. Alright? Okay.